Remember, there are 2 assessments that need to be done, and both are done by teachers.
We've done the SIB-R, yay! And now we're ready for the SIS-C. The SIS-C is Support Needs Assessment Scale. The first part of the SIS-C calls for identifying extra supports a student needs due to chronic health conditions or challenging behaviors.
Let's start with the medical section. There are 18 medical conditions or supports that are associated with medical conditions listed.
If the student does not experience the medical condition or require the medical support, the item should be scored 0.
I see that the first item is inhalation or oxygen therapy, and the short description is that this item pertains to a student who needs a nebulizer, oxygen, and/or a CPAP. This item would apply to a student with asthma or cystic fibrosis who might need inhalation or oxygen therapy. For a student whose lungs were healthy and had no problem breathing, they would have no need for inhalation or oxygen therapy, and their score should be a 0 on this item.
That's right. Healthy lungs and healthy breathing should result in a score of 0 on item 1 because no support is needed.
But what if a student had a mild case of what is known as pediatric chronic obstructive pulmonary disease, or pediatric COPD? Perhaps the teacher is not exactly sure what the supports the student may need for this condition at home, but the teacher knows that at school there isn't any special healthcare services or procedures provided to the student very often, if at all. The school nurse is aware of condition, and the student knows to tell the teachers if they feel short of breath or if they feel sickness coming on. But maybe there's only one time during the school year that the student's health condition has become a concern at school.
In the case you just described, a mild case of pediatric COPD, the correct score would be 1 because 1 equals some support is needed. For the student you described, school staff need to provide monitoring and/or occasional assistance, but extensive support is not needed.
So the highest score of 2, which means extensive support needed, is reserved for students requiring regular medical assistance and/or treatment at school.
Yes, a student with respiratory disorder that regularly requires medical treatment at school, or where consequences of not providing the proper medical treatment could rapidly escalate into a life-threatening situation. Those would be the cases where the student's support needs were extensive and merited a rating of 2.
Remember, the critical question to answer when completing the medical items is, what is the significance of the following medical condition for this individual in regard to extra support required?
Now, let's look at the behavioral items.
There are 15 challenging behaviors listed, or more accurately, there are 15 items that ask raters to assess the level of support needed to prevent or manage a challenging behavior.
The scale is the same in the behavioral section as it was in the medical section. Specifically, 0 equals no support needed, 1 equals some support needed, i.e. providing monitoring and/or occasional assistance, and 2 equals extensive support needed, i.e. providing regular assistance to manage the behavior. If the student does not display the behavior, then score the item as 0 for no support needed.
If the student displays the behavior and some extra support is required, for instance, those who interact with the student must be continuously aware of the behavior in order to assure the safety of the student as well as others in the classroom, then score the item 1 for some support needed.
And finally, save the rating of 2 for which significant extra support is required, especially those which take a lot of adult time to manage or which pose an important safety risk for the students or others. A rating of 2 means that extensive support is needed.
When attempting to determine whether an item should be scored a 1 or a 2 for a borderline case, the severity of the consequences of the behavior should be considered. For example, item number 3 on the scale is property destruction. If it were a concern, it would be important to consider how much damage the student could actually do if the behavior were to occur in the worst-case scenario and how life-threatening the property destruction could be. A student who engaged in destroying an entire room, for example, breaking furniture, smashing a TV, would pose a more serious risk than a student who is likely to throw his pencil across the room. It would also be considered more dangerous if the student was to threaten to break a window versus ripping up a worksheet. If there is a real risk that a behavior could have very significant consequences, the item should be scored a 2. However, if the behavior is likely to have a less intensive consequence, it would be best to score that item a 1.
Remember, the critical question to answer when completing the behavioral items is, what is the significance of the following challenging behaviors for this student in regard to extra support required?
Are there cases where students will have scores of 0 on all items of both the exceptional medical and behavioral needs sections of the SIS-C?
Yes, that is very common. Some students don't have any exceptional support needs due to medical conditions or challenging behaviors. Many other students will only have ratings in 1 or 2 items.
What if a student has a medical condition or exhibits a challenging behavior that requires extra support but isn't listed in the assessment?
In such a case, the medical condition or the challenging behavior should be specified and rated in the other item. Both the medical and behavioral have other list all that apply as the final item on the list.
One more thing, if teachers have questions or need clarification about any of the items, they should ask their coach or another research team member.
Now it is time to go and complete the medical and behavioral sections of the SIS-C, and the next step will be to complete 2 subscales of the SIS-C that focus on student participation and learning in the general education classroom.